Welcome to the Doctor's Life Podcast with Diane Ansari-Wynn, MD. Dr. Diane is a coach for doctors. With her 15 years of experience as an anesthesiologist and certification as a physician development coach, Dr. Diane coaches doctors on how to live a rich life of purpose, fulfillment, freedom, and happiness both at work and at home. In this podcast, Dr. Diane brings together doctors and researchers that are experts in health, wellness, stress, and burnout, as well as doctors that have been successful in clinical practice, academics, non-clinical careers, and business to share their expertise and life experience so that you can live your own life purpose, fulfillment, freedom, and happiness. To get free access to a PDF and video of easy and proven strategies that melt stress away and keep it away, simply register at www.dianeansari-win.com. That's www.dianeansari-winn.com. Now here is your host, Dr. Diane Ansari-Wynn.
Hi, it's Dr. Diane here, and I have a quick request before we jump into the show. If you like this podcast, it would mean so much if you took just a moment to hop over to iTunes, write a review, and rate the show. That is how other people will find the show and get the same great value from it that I hope that you're getting. It just takes a few moments to click a star rating and write a quick note. Now, on to the show.
Well, hey, everyone. Welcome to the Doctor's Life Podcast. I am your host, Dr. Diane Ansari-Wynn. Today, we are talking about physician leadership. Physician Leadership 101. Where to start, how to know if you're a leader, how to get into leadership, and I'm speaking to an expert today with many, many years of personal experience, Dr. Linda Morris. Dr. Morris is an internist who really exemplifies physician leadership. She started off as an internist and had a very distinguished career in the VA system. She was Assistant Chief of Medical Service for Ambulatory Care, Director of a Women's Health Clinic, and she became Chief of General Internal Medicine and Administrative Medicine at the Memphis VA Medical Center, and then became Chief of Staff of the Martinsburg VA Medical Center. Dr. Morris is also a coach. She's been a senior consultant at the Sinclair Advisory Group since March 2009. She's also principal of L.J. Morris Consulting, and she's an adjunct coach at the Center for Creative Leadership. Dr. Morris, it is so great to have you on the Doctor's Life Podcast today. Thank you so much. This is going to be an awesome interview. So we start off how we always do, which is getting to know a little bit about each of our guests. They're all inspiring. They all have interesting lives and interesting stories to share. How about sharing about your path into medicine?
Well, as a child of, elementary school age, somewhere around 8 or 10, I started to really develop an interest in science and in particular biology or life sciences, I guess is probably what we called it then. And I had an aunt who was a nurse. And so that was what made me think more about medicine. And so I told my mother, I was thinking about being a nurse. And she said, well, that's great, but why not also think about being a doctor? And I came back with, I can do that because I didn't know any women physicians. There were none
you go, Mama.
in my hometown that I was aware of. And I'm pretty sure there were probably none there not that I had to see them all, but I just didn't see about them or read about them. My father was in the military. I would go to the military clinics or hospital, and I saw no women doctors there. And she said, sure, you can do that. And then my sister gave me a book. She was a librarian, so that would be what she would do, that talked about women in medicine.
Wow.
And I said, well, yeah, I think I want to go to medical school. And here I am. Yeah, I went to undergraduate school and majored in biology and then went on to medical school and thinking I'd be a pediatrician and ended up being what I refer to as a pediatrician for adults in internal medicine and really fell into leadership. Wasn't planning to do that, just thought I would go into private practice and, take care of patients. I never got into private practice. So
how did you fall into leadership? I'm fascinated with your journey. How did you fall into leadership?
Well, I was working in the emergency room at the Washington, D.C. VA Medical Center. There was a woman, I did that right out of residency. I started working part-time for about a year and then became full-time staff there and was enjoying working in the emergency room. And there was a woman who was running it there, and sometimes when she was, on vacation, I would ask for her. But that would just be for, maybe a week, every now and then, a couple of weeks at a time. And she was very receptive to anything that I had to offer about how we might do things a little bit differently in the emergency room that would make us more efficient, more effective, improve quality of care.
Mm-hmm.
She was open to that. So when she was getting ready to move on to another position at the VA in geriatrics, she said, so have you thought about applying for this vacancy that I'm about to create? And I thought, no, I really haven't thought about it. She said, but you'd be so good at it. So I did. Yeah. And just, like I had just sort of, as I described it, sort of, I guess, dabbled my toe in the pool by acting for her. And the fact that she was receptive to the suggestions that I had about how we could do things a little bit different to make the system better just made me think, well, yeah, maybe I can do this. So I started there in the emergency room and did that for several years and then transitioned to running the clinics because we had clinics that were heavily resident-oriented. We had residents from George Washington, Georgetown. At that point, we still had a Georgetown VA program, so we had 3 different groups of residents, but all in the same clinic, and so then I transitioned to running that. And just kind of went from, when I went to Memphis is when I was running the women's clinic and ambulatory care. We called it primary care and administrative medicine. And then on to chief of staff in Martinsburg. Having somebody who was a mentor for me helped a lot. She sort of nudged me in that direction.
Right.
Because just about the time that I made that transition into leadership was when I was beginning to think, well, I think it's now time for me to leave the VA and perhaps go into private practice, because that's what I had always thought I would do.
Yeah, okay.
But then when she gave me this opportunity, I thought, well, this is wonderful, and I never looked back, and I never reconsidered going into private practice.
Yeah, that is really neat. Sounds to me, from what you were describing, is that you kind of had a natural leadership ability or interest. And we were talking about whether or not leaders in general, but physician leaders, if they're born or made or both. From your experience being a leader as well as an executive coach, what do you think? Are they born or made? Or
my answer to that question is yes. Speaking both from a personal point of view and from what I've learned in the leadership development opportunities that I've had and the reading that I've done about leadership, I think that for me it was about having a systems view of the world, and as long as I was seeing patients one-on-one, I was perfectly happy doing that, and I was perfectly happy having the impact on their health and their lives that I could have. But when I saw an opportunity to tweak the system, those were the kinds of things that made me think about, well, I could even have a broader impact. And so I think there are some people who are sort of born with that, if you will, inclination to have a wider impact than what you can do one-on-one as a physician seeing patients, doing it one-on-one and never ever rising to a leadership position. If you're perfectly happy doing that, then that's fine. But I think even if you have that natural inclination to want to make the system better and to have a wider impact, you can still benefit and be better at leadership from taking advantage of leadership development opportunities, training, mentoring for sure. If you have no interest in doing anything more than having that one-on-one impact, then all of the leadership training in the world I don't think will make you happy and content at what you're doing, and therefore it will probably, as a leader, and therefore would have, I think, some impact on how effective you would be as a leader. So, I think you can have a little bit of an interest or a lot of an interest and then get some development training, leadership training that can make you really good and much better at what you might have had a natural inclination to do. And then other times you might not have known that you had an inclination to do it, but sometimes just being given those opportunities and trying something on a smaller scale might help you see that I really enjoy this and I want to get better at it, and then you would seek any kind of training opportunities that you could find. That's why I answer yes to are leaders born or are they developed.
Right.
Because I think, it's a mixture, and whatever your natural inclination is. The main thing is, are you content? Are you satisfied with what you're doing? And are the people around you are obviously benefiting from what you're doing? It's not an either-or situation when it comes to leadership, and regardless of what your profession is.
That kind of touches on a topic that we've discussed in the podcast often, particularly with Dr. Stephen Beeson from the Physician Effectiveness Project. Sometimes you hear a little bit of criticism where if you're a doctor, you've gone to medical school and you do residency training and all that, so you should be taking care of patients. And the leadership piece of it is somewhat discounted at times. Why are physician leaders so important in healthcare?
Well, I think they're important because we understand the nature of the core of healthcare, of taking care of patients. We know what that's all about. I mean, that's what we train for, those 4 years in medical school and those X number of years in residency, depending on your specialty, and then your actual practice of medicine. We understand that. And you can always learn the finance part, the health law part. Whereas if you are an MBA or a JD running a healthcare organization, you got the business end of it. You will not understand the healthcare aspects of it like a clinician will. When I have that discussion with some people, I say, CEOs of banks or bankers, they're not chemists, they're not engineers, and maybe there is some bank that's run by an engineer, but for the most part, they're bankers. They know the industry. And so as clinicians, as physicians, we know what it means to be in a room with a patient or in the OR with the patient or whatever, and what your goal is in taking care of that patient, the patient's family, the communications. We understand that, and we've done it. We've lived it. We breathe it. And so why not take it to the next level? And I think we are beginning to see that trend more and more now because, unlike when I came out of residency, most, and it still may be the case at most, but I didn't know of one facility in the metropolitan area of D.C. and probably not even Baltimore that was run by a physician. And that's no longer the case. I don't know what the numbers are now, but we certainly are seeing many more healthcare facilities that are run by MDs, some by nurses, but are run by clinicians because we get it. We understand the business that we're doing every day. And like I said, you can always learn the, if you will, the business end or the more technical business end of it, however you choose to do it. And you obviously, whatever your background is, you need, as a leader, you want to surround yourself with people who are the experts in the finance and the experts in the health law. You certainly need to learn enough to be able to ask the right questions of those experts, but you're the expert in healthcare.
Right.
That a JD and an MBA will never be. Except for my last 6 years of being the chief of staff in Martinsburg, I was also able to maintain 1 or 2 days a week that I could see patients.
Okay.
There were times when I was seeing patients every day, but the higher up the ladder I went, I did have to scale back on how much I was seeing patients. Probably the only reason I didn't see patients when I transitioned to be the chief of staff was because I was also new to that facility, and I really didn't think it was fair to patients to take on being somebody's physician, knowing that I would have to be away as much as I would have to be away as the chief of staff. But if I had already, when I transitioned and I already had a core group of patients that I was responsible for, I might cut that number back, but they knew me, they trusted me, there was a relationship already formed, and I worked really hard to make sure that on the days I was going to be in clinic, I was in clinic and not at a meeting or whatever. So there is a way sometimes to do both, but as you go higher up the ladder, it does become more challenging. I will certainly say that. But then for me, the reward was, so I'm no longer seeing patients individually, but I'm operating at a level that's making the care that they're getting that much better.
I like your analogy about the banker, and that makes a lot of sense to me. And I also like how you were able to keep in touch with the clinical side. You had a long leadership career, And you're the perfect person to ask about what are some of the rewarding aspects of leadership and some of the challenging aspects of being a physician leader.
I'll start with some of the challenges. So there certainly is a need to learn something about the business end, as in the finance and the legal aspects and the HR side of the organization that you're working with or working for. So that was a little bit of a challenge for me to make the time to do that, to find the opportunities to do that, whether you do it through either some kind of formal training or finding a CFO that will just sit with you and explain things to you and answer your questions patiently. So that was a little bit of a challenge for me. And then I'm sure you've probably heard the old adage, managing physicians is like herding cats.
Heard it once or twice.
Yeah, well, but I have to add quickly that that's true. I hear in many other professions, lawyers say that about lawyers, educators say that about managing other educators. I don't think there's anything that much more challenging about managing physicians. But I did find that managing people who don't really want to be managed, whether they're physicians or whatever, can be a little bit of a challenge. And so you have to learn how to finesse that, how to work with those people. And again, for me, some of my leadership training helped to give me tools to be better at that.
It sounds as though those skills can be picked up as you go.
They can.
If you have you have the drive, the initiative, and make the time.
Right. And then, like I said, there is stepping back from and sometimes totally stepping away from that one-on-one patient interaction. And like I said, you can find ways because, one thing I tried for about a year or so when I was the chief of staff at Martinsburg was I tried running a group clinic for diabetics. So that gave me a bit of some one-on-one patient interaction in a group setting, but I wasn't their primary care doctor, so I thought I was being fair to them. So, again, being creative about how you can still interact with patients in a different setting. The reward for me was knowing that some of the rewards I think that any leader has is knowing that you are making things better as a physician. You're making things better for patients across the board, not just the patients that are in your panel, and that you're making things better also for your colleagues, for the other clinicians that you work with. And so you're just having a wider impact on improving the quality of care at your institution and making a more efficient system, creating more efficiencies, you hope, in the system, and working with your colleagues in a different way. So that's, I think, a big reward for physicians who step into leadership roles, that you're having just a wider impact than you could ever as an individual doctor seeing patients one-on-one.
Yeah, and the physician leaders that I've spoken with, they cite that as being one of the primary things that they find being so rewarding in that kind of work is knowing that we went into healthcare wanting to care for people and for the greater good, so it makes sense that physician leadership would be a part of being a physician. It's not necessarily, as you pointed out, the traditional route in a way, but it's certainly one that's really needed and eventually it's appreciated by everyone as well. We've talked about are good leaders born or developed. We've talked about why physician leadership is important, rewarding versus challenging aspects of leadership. So a couple of other concepts that I wanted to explore with you is David, talk some about the things that the tools that you had used during your long career as a physician leader and as an executive coach as well. So what, in your view, makes a good leader?
So that's a great question, and that list could probably go on and on, but I'll talk about some of the key elements that I think come up over and over again, and again, regardless of whatever industry you might be working in. The first thing that I think about is being willing to hold yourself accountable and to welcome being held accountable by others, because the people that you report to will certainly hold you accountable, but so will your peers and the people who report to you. And then also being able and willing to hold others accountable. That's a major part of leadership, and that can be quite challenging for some people. Sometimes not so much holding themselves accountable, but the ability to hold other people accountable can be a bit of a challenge, and why some people shy away from leadership, and that's perfectly fine if that's not what you want to do. But I think that's one of the first and foremost aspects of leadership, that having that characteristic of being willing to develop that, let me put it that way, will make you a much more effective leader. Some of the other characteristics, I think, of a good leader are being willing to make decisions, but to do it in a collaborative way. There are times when you simply have to make an executive decision, but most of the time you need to be willing and able to listen to folks around you, and again, on all levels, above, at the same level, those who are reporting to you. Gather some data as physicians. That's something that we like, but at some point, knowing when you've got enough data, knowing when you've done enough listening, then it's time to make a decision. Because sometimes we can get caught up in what we call analysis paralysis. So knowing that balance of I've listened to enough people, I've gotten enough data, and now it is time to make a decision. I've done the collaboration, but being willing to make a decision and to stand for it, because not every decision is going to be right. And so you admit that maybe that wasn't the best one, and you regroup and you move on. I think that's very important. Being reliable, people need to be able to count on you. They need to be able to know that you will do what you say you will do, no more, no less. And sometimes that can be a challenge because we're not used to balancing too much on our plate. And then when things start to fall off our plate, it's because we weren't able to maybe say no and to take something off our plates before we put something else on. So learning that balance, being able to say, no, I don't need to do that, maybe somebody else should do that, and building on your reliability and people knowing that you will do what you said you would do is very important, I think, to becoming or to being an effective leader. Another characteristic is being adaptable, flexible. The world is constantly changing, and sometimes for physicians that could be a challenge. As an internist seeing patients, I can remember when new guidelines would come out for managing disease ticket, and sometimes it would be really hard to get us to adopt the new guidelines.
Yes.
Because, when I was in residency, this is how we did
right.
it. Well, that was 100 years ago. Yes. As leaders, you have to be able to lead change. So that certainly means you need to not be the stick in the mud, but you need to be willing to adopt new change, help others adopt new change, and be willing to constantly learn. Again, as physicians these days, you are constantly learning. So whether you're a clinician or a leader, that's part of it. But as a leader, you are learning not only about medicine, but new ways to be a leader also. And what your organization will have to do to stay effective, to stay a leader in the industry, to be able to take care of patients and provide the quality of care that everybody who works there will be proud of. So being flexible and adaptable, I think, is just, it got to the place, it can get to the place where you feel like that's all you're doing sometimes is adapting and leading change, and sometimes you're creating the change, but that's really crucial to being an effective leader. And then one of the last ones that I'll mention is being able to engage and influence the stakeholders in your organization. You need to be able to listen to the people that work around you. You need to be able to collaborate with them. You need to be able to get buy-in, because for that change that you're creating, you're going to need buy-in. And one of the things that can be challenging for some physicians in that role is that you are collaborating and you're not just writing orders for your peers or your direct reports to follow. So you really do have to learn how to listen carefully, just as you would listen to a patient that comes into your office and describes whatever their symptoms are. So those are skills, again, that we learn in medical school, and you will sharpen them if you step into that physician leadership role, to listen carefully, just as you have to work, certainly as an internist. A lot of what I did as a clinician was to try to get patients to be willing to make lifestyle changes.
Right.
And so I had to listen to what was important to them and to help them figure out why they needed to start walking or riding a bike or whatever they were going to do. And you will do the same thing as a leader, to engage with the stakeholders around you, figure out what's important to them. One of the things that sometimes people say, you need to be good at motivating folks, and I take it a different way. I think that most people come to work motivated for whatever reasons they're motivated, and you need to find out what their motivations are and how you can leverage that and to help you and the organization to move forward with whatever the change is or whatever the concern is that you have that at that moment, at that hour, at that year or whatever. So I think influence is usually what I tend to use that word more than motivate the people around you.
Right.
You certainly need to get good at listening to people, collaborating, and influencing up, because even if you're the CEO, you've got a board that you got to work with, that you report to. If you're the department chair, then you've got somebody over you that you're reporting to. So you've got to get good at influencing up and collaborating with those above you, as well as your peers and as well as your direct reports. So I think that is really crucial to learn how to engage and collaborate and influence those that you work with. So I think those would be the top, 4 or 5 characteristics of a good leader. And like I said, some of those are things that are sort of a part of your DNA perhaps, but they might be a smaller part of your DNA that you can build on if you want to build on it. And so if you know that decision-making might be a bit more of a challenge for you, then that's the kind of thing that you can get better at and more confident about. And so, if somebody is listening and says, I really am not that great at being decisive. Again, if you want to do something about it, if you want to change, and you know this also as a coach, you can do it. It's just having the desire to want to strengthen that muscle.
I hear what you're saying. And when Alma started medical training, we didn't do a physical exam. We couldn't interpret an x-ray.
Right.
We didn't know how to draw blood, so all those things you can learn. That segues into, and we've talked about it some, say someone on the podcast is interested in, they said, hey, maybe I've been doing some leadership in my clinic already, or maybe we have some residents or young staff listening, and they're interested in leadership, but they really kind of don't know how to get involved or develop themselves for leadership positions. What do you suggest?
Well, I suggest that people first start to just look in their own backyard. Now a number of healthcare organizations are developing leadership development programs, some of them sometimes specific for physicians, other times they might not be specific for physicians, but for clinicians at their facility. So, look at what's available right in your own backyard. And outside of that, I would say there are organizations like the American Association for Physician Leadership that offer opportunities for training, both either in person and online training is available. Look at if you live in a city or in a region where there are medical schools, or even not medical schools but universities, see what might be available there that they have for leadership development. And like I said, it doesn't have to be specific to positions, because for instance, the characteristics that I just mentioned for leadership are across the board. They're not specific to physician leaders. So you don't have to be in some kind of leadership development program that is specific to docs, but any kinds of opportunities that might be available to you, either in person, online. Just, if you are looking at something online, that just make sure that it's legitimate, that you're reading reviews, that you've done your homework. But even a number of universities have some things that you can do online also. So, And the other thing I also like to remind people is that if you're seeking this, ask especially if you're working for a large group or a healthcare facility, ask them whether or not they'd be willing to invest in your leadership development, to send you to a course or to enroll you in whatever you find online. All they can say is no, but if you don't ask, you don't know. So don't assume that you have to. And a mentor. I just, I mentioned that in talking about my journey, but to collect mentors along the way, I think is really crucial. And I always remind people that a mentorship should be at least a career-long relationship, if not lifelong. And it is primarily up to the mentee to take the responsibility for sustaining that relationship. But to talk to mentors about how they got where they are, what did they do? And, but you certainly don't need to. I mean, if you want to get an MBA and you just find the MBA coursework fascinating, then go ahead. But you certainly don't need to have an MBA. You certainly don't need to go to law school. There are other ways to do it. Like I said, if you just have a burning desire to do one of those things, then by all means. But you don't have to do that to prepare yourself to be a very successful and effective physician leader.
Good. That's good to know because that comes up a lot, like, do I need an MBA? Do I need this? And then also the practical matter, as you described, you started subbing in for the leader.
Right.
And so you can test it out, join a committee, start looking for opportunities in your own practice. Another way that docs that I know have gained some leadership experience is in their local medical society, and or even at the local level or the state level, national level. There's a lot of work in healthcare that gets and promoted by societies, either your specialty society or a national society like the AMA or the National Medical Association, groups like that. There's also an interest in a healthcare-related organization like the cancer group, or, there's ways that you can become an active leader in a lot of ways that you don't have to think like, oh, I want to be a leader. Because I think sometimes docs think like, oh, I want to be a leader, so I have to go to school to become a leader, and then I'll look for leadership positions. And it almost sounds like that's almost, you can comment on it, but it almost sounds a little backwards to me, because it's not like going to med school, then you become a doctor. Like, you become a leader by leading.
Right. And you can start, like you said, you can chair a committee. You can lead some special project that's getting started, at your healthcare organization, the subbing in when somebody's on leave. So there are all kinds of ways that you can just sort of test the waters, see how much you really like it or not. But you certainly don't have to go to school to do it.
Yeah, but at least, get the first part of it. Like, that'll become more obvious, the additional training that you might need. And then, and as you go along, coaching as well. You have to give a nod to coaching.
Of course. Some of the greatest coaching experiences I've had have been both within the VA and even after I've left the VA, but physicians who were enrolled in a leadership development program that it might have been 6 or 12 months, and coaching was a part of that. And a coach can help hold you accountable to put into action what you're learning in a classroom setting. I'm
glad you clarified the role from your perspective and how they can help you, guide you, but ultimately it's your goals, your plan, your execution, your accountability.
For sure. We can't do it for you. But, it's easy to go to a 3-day or a 1-week seminar or whatever on leadership and to come back and to either do nothing with it or to do something with it for a week or so, and then to sort of, if you will, relapse into your old way of doing things. And by working with a coach over some period of time, the coach will be saying, so what are you doing about this new behavior that you wanted to, implement? So, how long did it take you to make that decision, since that's what you're working on? That's the muscle that you're trying to bulk up. And how did you make that decision? So, those are the kinds of questions that a coach will ask you to help you get to where you want to be.
Awesome.
I also just like to remind people that what you also need to be mindful of as a physician leader is that you need to, just as you were compassionate with your patients when you were seeing them one-on-one, you need to practice some self-compassion for you and allow yourself a little room to not always be right and to be compassionate for the folks that you're working with also. That's something that can sort of come more minor for you sometimes as you focus on becoming a leader, and it needs to continue to be an integral part of how you show up every day.
Well said. Well said. Well, Dr. Linda Morris, this has been a great conversation. I'm so happy that you gave us the opportunity to be able to learn from you, learn about leadership. I hope that we've inspired some potential leaders out there and encouraged and helped the position leaders that are already in leadership positions that are listening to the podcast. Thank you again, Dr. Morris, appearing on the Doctor's Life podcast. Certainly appreciate your time and your expertise.
Well, thank you so much for the invitation. I certainly hope that your listeners have benefited from this, and it's been a pleasure and an honor, so thank you so much.
You're very welcome. Well, everybody, thank you so much for coming and listening to the podcast today on physician leadership. Tune in next time when we'll have another interesting discussion, and until then, I hope everybody stays happy and healthy. Take care.
You've been listening to the Doctor's Life podcast with Diane Ansari Wynn, MD. Go to www.dianeansari-wynn.com to read show notes, listen to past episodes, share your comments and show ideas, and pick up your free PDF and video of easy and proven strategies that will melt your daily stress away. That's www.dianeansari-winn.com.